think we have the energy here to bring home this win. Importantly, I think we have folks who are committed heart and soul to making sure we don't just have cracks in that glass ceiling. We finally shatter it, folks. Yeah. It saddens me that here in the Commonwealth, we've only ever had one female governor, but man, wasn't she amazing in Washington? It's been 3 decades since, and I don't know about you, but I'm ready to see a female president in Washington, D.C. Now, to say that my family goes back with the Clintons, it would be an understatement. Over 2 decades ago, I welcomed the president, his family, the first family, into Washington, D.C. at the steps of the Lincoln Memorial. I have had the privilege and pleasure to give introductions to someone who is literally like a sister to my family. She just doesn't have a first name that begins with an A. Alyssa, Abby, Alison, Ashley, and Amy. But she did have the smarts to name her first child after my mama, Charlotte. And what's so amazing about this woman is that in her time in public service, she has made a huge impact globally on education, on healthcare, on civil rights. She is not done yet, and we are excited to have Chelsea Clinton here today to open up Hillary Clinton's headquarters. Please join her hands and welcome Chelsea Clinton.
Oh, Alison, thank you for that incredible introduction and dose of Kentucky hospitality. I also want to thank former Governor Martha Lane Collins for warmly welcoming all of us, and it's quite warm in here, so thank you all for bearing with us. I want to thank Alison's whole family for indeed their decades of support, but particularly now. I want to thank Lindsay Hughes Thurston, Kentucky's Assistant Secretary of State Representative George Brown, Councilwoman Angela Evans, and I'd like all of you to give a round of applause to Elizabeth and all the organizers who are going to be working so hard here in Kentucky. Although I stood in the back while Alison and Martha were speaking, please forgive me for sitting down. And I feel quite sheepish because I know most of you are standing, but for those of you in the back who can't see, I'm quite pregnant. Thank you for applauding for that. So please know that I'm sitting because I hear my doctor's voice in the back of my head telling me to not stand for very long. And it's not at all a reflection on my enthusiasm for this campaign or my gratitude for all of you taking time out of your busy schedules to be here with me this morning. I think this is the most important presidential election of my lifetime. And I feel that way for 2 fundamental and interconnected reasons. The first is a deeply personal one. I cast my first vote in a presidential election as a mom when I got to vote for my mom in the New York primary last week. And I didn't know I could care anymore about politics until my husband and I were blessed to welcome our daughter Charlotte into the world 19 months ago. And as we look forward to hopefully welcoming an equally healthy and happy sibling for her this summer, and I found I could care more about who was elected to political office, who was running for public office at every level of government. And that really surprised me because I grew up spending a lot of time in rooms like this. I mean, I grew up spending a lot of time in my dad's campaign headquarters when he was running for re-election as governor of Arkansas. I have many memories of answering phones saying, Clinton campaign headquarters, may I help you? And stuffing envelopes back when that was a big part of campaigning, organizing. Yes, some of you are nodding, you remember those days too. And yet becoming a parent has made everything feel more intensely personal to me. The things that I already cared so much about, I found I could care even more about. Everything that Alison mentioned, women's rights, equal rights, things she didn't mention, like gun control, I found I could care even more about. And this election then means so much to me on a personal level because I know that whomever we elect will play a profound role in shaping the country, the world, the future, and the values that my children and their generation, and I'm pointing to now two adorable little ones off to the side, will grow up in, and they are remarkably well behaved. My daughter would not be this quiet if she were here. And the second reason I think this is the most important presidential election of my lifetime is that I think everything I care most about is at risk. So I just want to share a little bit about what I mean by that and why I'm so convinced my mother's the only person to help us navigate forward at this moment in time, and then open it up to whatever questions you may have that I may be able to help you answer as you hopefully take up Alison's charge and spend as much time as you possibly can in this room over the next few weeks, reaching out and talking to people about what's at stake in this election. If I think about healthcare or education or our economy or women's rights, I worry that all of that is currently under a threat. I think Alison in some ways was too kind to the Republican rhetoric. I mean, when I listen to the almost daily hate speech that's coming out now from the Republican primary, the racism, the sexism, the Islamophobia, the homophobia, the anti-workers' rights rhetoric, the anti-Americans with disabilities rhetoric, and just it goes on and on and on. And then the policy proposals that flow from that, to keep a list of every American Muslim, to have discriminatory policing in our country, to take away a woman's right to choose. See, the microphone didn't think that was a good idea. You know, it matters to me that my mom has been making progress in standing up for and advancing our values for literally longer than I've been alive. And I think what someone has been able to do is a good indication of what they will be able to do in the future. And so it matters to me that when my mom got out of law school, she went to work for the Children's Defense Fund, and she fought for the right of every child to be able to have a free, public, good education in our country, regardless of disability status. That when she was First Lady of Arkansas, she brought the first public early childhood education program to Arkansas that the state had ever had. When she was First Lady of our country, after her efforts for universal health care coverage didn't work out in 93 and 94, she didn't give up. And as her daughter, I would have understood if she had. It was a pretty bruising, brutalizing time. A lot of the attacks against her healthcare plan were targeted to her personally. But she kept working and fighting, and she built a bipartisan coalition across Democrats and Republicans to create the Children's Health Insurance Program. That program now insures more than 8 million low-income American children, including tens of thousands here in Kentucky. When she was First Lady, she worked to overhaul adoption out of the foster care system. Because of that work now, in any given year, there's 60 to 80% more young people and children adopted out of the foster care system than was true in 2000. When she was a senator from New York, she worked to extend the VA system so that it included all of our National Guardsmen and women who serve our country overseas, so that when they come home, they and their families can take full advantage and be full participants in the VA system. And she doubled federal funding for early Head Start programs, something she also did with Republican support. It matters that people know how to make progress, particularly on behalf of our children and our families, our veterans, those who are most vulnerable, those who've too often been left out and left behind, and those who too often don't have a voice. It also matters to me that my mom's been fighting for certain areas of progress that she hasn't yet been able to realize. Every year she was in the Senate, she introduced a child care tax credit because she knows how important it is that families are able to make what we think are the right child care decisions for ourselves. And she knows that education starts the day a child is born. 80% of our brains are built by the time we're 3. It matters to me that she first started fighting for an infrastructure investment program back in 2006, was a core part of her campaign in 2008, and it's a core part of her campaign now in 2016. And for her, this is a moral and safety imperative. It's just one snapshot. The Army Corps of Engineers says we have about 1,000 bridges across our country that will be structurally unsound by 2030, including dozens here in Kentucky and across the region. And because it's clearly now a moral and public health priority, given what we're seeing in Flint and in so many parts of the country where the infrastructure we can't see is really failing our children and our families. So it matters to me what my mom has done. It also matters to me what she's fought for and hasn't been able to do yet. And so I acknowledge quite proudly I'm very biased towards my mother, and I don't pretend to be otherwise. I hope that my children feel toward me the way that I feel toward my mom. I hope my children are even an iota as proud of me someday as I am of my mom. And I couldn't imagine a better grandmother for my children than my mother. But I really couldn't imagine a better president for any of our children, our grandchildren, than my mother. And so, even though I get more and more pregnant, I just am gonna keep talking to as many people as possible in the states that have not yet voted. Because I think there is so much at stake in this election. And I think we need someone who is a problem solver. We need someone who knows how to make progress, the perfect be the enemy of the good, and who always stands up for our core values. Because as we're seeing right now, we can't take anything for granted in our country. And so this is a really personal election to me, because for me this is about my daughter and my future children, even more than it's about my mom. So again, I just want to thank all of you, those of you who've already volunteered for your time, those of you who will volunteer and take up Alison's charge, those of you who aren't yet old enough to vote, but I love the Born Something t-shirt because it already is showing a kind of activism bent from our youngest audience member. And if you have questions, I'd be happy to try to answer them. If you have thoughts or suggestions or stories you want to share, I'm always wanting to hear those. And thank you so much for this sign about me. That's the first time I've seen that. That's very nice. Thank you.
So really, thank you all so much. And if you have questions, please ask or thoughts you want to share. Please do. Yes, ma'am.
Welcome to the Bluegrass State. I just wanted to know, how does Miss Hillary feel about the heroin epidemic that is plaguing every state? We here in the Bluegrass, we suffer from hypertension, HIV, Hep C. So how does she feel going forward about tackling the heroin epidemic in every state?
Thank you for asking your question. For those of you who couldn't hear, her question was about the heroin epidemic and really the opioid epidemic more broadly. My mom thinks we have to do a few things very quickly. One, we have to recognize that this is a public health crisis, kind of first and foremost, and that we need to be investing in both prevention and treatment. You know, I don't know the statistics here in Kentucky, but in New York, many of our treatment facilities have waiting times of months. So even people who are desperately looking for help to recovery and to be able to transcend their addiction are not able to get the services that they know they need and they are reaching out for. I would not be surprised if there are similar statistics here. So we have to build our treatment infrastructure, and we have to build on what works. And in different parts of the country, sometimes that's programs through churches and religious institutions, sometimes it's programs through community centers, sometimes it's programs through local hospitals, sometimes it's programs through shelters, sometimes it's all of the above. But we need a massive injection of funding and hiring of social workers, treatment counselors, nurses, because we know that recovery requires a real team-based approach to help people be able to move past and then move on from their epidemics. We also need to be doing more to support families that are suffering.